Good morning. Today we're going to be talking about sickle cell disease and how to prevent it. The World Sickle Cell Day was on the 19th of June, but it's never too late to talk about something that's as important as this. Good morning, Dr. Davies. It's a pleasure to have you with us.
Good morning.
Yes, so we're going to be talking about sickle cell disease, and you would assume, really, that all Nigerians, seeing how common it is in our own environment, know about it. But if you can just give a quick intro, just in case there's anybody listening that doesn't know much about sickle cell disease, can you tell us what is sickle cell disease and how does it manifest?
Okay, good morning. Thank you for having me. Sickle cell disease is a genetic disorder whereby a parent donates a gene and the mother too also donates a gene, and then they come together. So when we have a hemoglobin which carries oxygen, there are different types. So if a mother has an S hemoglobin and the father has an S hemoglobin, they donate each and then to form a child. And this child would have what we call sickle cell anemia. When this patient has sickle cell anemia, the problem now is the fact that this blood becomes deformed and they can't move through vessels. When they can't move through vessels, they block the vessels and prevent oxygen, which is the primary aim of red cell, to carry oxygen to the various sites, and they block this oxygen from getting to these areas. And this patient present with pain. Most of the time they have pain. However, they can also present with severe anemia, where they need to be transfused as frequently as possible. So they have varying clinical presentation. They could have leg ulcers, they could have priapism, they could have stroke, So, and then you have so many predisposing factors where sickle cell anemia, they can, dehydration, when there is extreme stress, there is malaria, they could predispose them to various sickle cell crises that they could present with.
Now, sickle cell is an very interesting, it's actually very common here in West Africa, and Nigerians have really the largest population of it, but it's seen all over the world. Now, can you just talk about that a bit more? Because, it doesn't seem to us like there's enough research being done to really, assess and suss out the condition. Like, for example, now you're talking about triggering factors. These are some of the things that, everyone should know. Could you elaborate on them a bit more?
Yeah, there are a lot of research going on with sickle cell anemia. However, sub-Saharan Africa has the highest burden of sickle cell anemia, and Nigeria is one of the top 5 of sickle cell burden in sub-Saharan Africa. So a lot of awareness needs to be put in patients to be able to know their genotype. So what Lagos State is doing presently is newborn screening of sickle cell, so that patients would be able to know their status as they are born. And then they also sickle cell prenatal clinics where they can, before marriage, the parents or the spouses can know their genotype before getting married, and then reducing the incidence of sickle cell anemia in the sub-Saharan Africa and Nigeria, which is topping the list. So it is important that we create awareness about sickle cell, that every child born should be screened for sickle cell traits, and subsequently we can detect children that have sickle cell anemia, which would eventually lead to sickle cell disease burden in sub-Saharan Africa. So it is important premaritally that people getting married should be screened for their genotype, and then they can prevent the rising incidence of sickle cell disease in our community. It is also important that secondary school children must know their genotype. In that way, awareness will be there before they, get to the age of where they get into a relationship, that they would not, marry those that have the sickle cell traits and then increase the burden of sickle cell anemia. So it is important that there should be an increasing social awareness, social medicine awareness to the general populations that they need not, increase the burden of sickle cell disease in our environment.
No, that's good. And that's important because the whole focus this year is on preventing sickle cell disease. But are there any laws or any actual policies by the government to try and do this? Or is it just because I'm aware that many churches will not marry a couple unless they present their genotype, the fact that they know their genotype and present their certificates. But is it actually a law or a policy, or is it just something that churches do?
Presently, there is no policy concerning preventing patients with sickle cell traits from marrying each other. There is no policy presently. It's just the churches on their own when they start seeing that the burden of patients that have children with sickle cell, the marriage issues, they are being proactive by preventing such marriages from happening, thereby preventing those children being born from sickle cell. So there's presently no policy. The church is just being proactive with their screening and then their policies. Yes.
Well, to be honest, I think it's good, but it's a bit difficult, I guess, to regulate against this because love is love. If somebody loves someone else, it's difficult to say when you love someone, most of the time you're ready to go through, thick and thin with them. So it's not so easy to say, well, sorry, you've got the wrong genotype. I'm not marrying you anymore.
That is why we are advocating for, newborn screening, that every child in secondary school, max, they must know their genotype. We usually don't want them to, fall into relationship before they now know their genotype. And then, it's usually difficult for once love is established before you now tell them that they can't marry. It's usually difficult. So if Lagos State can make a policy that every child knows their genotype. So in secondary school, once they are aware, by the time they are getting into the university, getting into relationship, they're already aware about their sickle cell genotype, so they can make an informed decision in preventing themselves falling in love in the first place and then giving birth to children. So it should be like a social norm, like what's your genotype, what's your genotype. It also helps, okay, before we even say I love you or I can go into a relationship with you, that should be the first thing. We want to create awareness. So this program is also helpful. People would get to be aware that they need to know their genotype, and it should be the first thing before they fall in love. So we don't want them to fall in love before they now, find out their genotype. So, but when they know their genotype, it's easier to now choose, okay, I want to go ahead because they are aware of their status and they can prevent the increasing or rising incidence of sickle cell anemia in our environment.
Yeah, well, I think so. I think that's really a good one. But I think perhaps if these are things that perhaps the National Health Insurance Scheme could perhaps look into, the whole issue of knowing the genotype. And I think just for clarification's sake, for people who are listening, that's AS. Two ASs, I think, shouldn't marry. Am I correct? While if
Yes,
you're AA, you can marry anybody. Can you just explain that whole who can marry who so that we can, just run that by us again so that we can understand it in simple terms?
Okay, in simple terms, each individual has two genotype. So there is A, there is S, there is C, there is D, there is Punjab. There are varying different types of genotype. However, the commonest we have is A, S, and C. So we don't want individuals that have an S to marry another individual that have an S. So each individual has two. So yeah, it could either be AA, it could either be AS, you could either be AC, you could either be AA, AACC, or an AS. So we usually don't want people that have defective hemoglobin marrying each other. So once you have a trait, the chances that the other party that has another trait of the S, once they come together, it becomes 2 SS, and then they could give birth to children that have SS. So usually advise when they have both individual having an S trait, preventing them from getting married, as well as C also.
So that's either an AS or an AC should not marry each other.
Yes.
So AS should not marry AS,
Yes.
AS should not marry AC, AC should not marry
Yes,
AC,
please.
so that they just sort of keep clear of each other. But AA can marry
Yes,
anyone, and SS
AA
should not
can
marry,
marry
and
anyone.
SS has to be very particular about who they marry. They must
They
only
must
marry
marry
an
an
AA.
Yes, please.
Okay. I think that makes it quite straightforward for those who are listening. What if there is anything other than an AA, they should not marry each other, but everybody should be looking for somebody with AA. I think
Yes,
is
please.
the
And there are
key.
quite
I think it's that
there are
simple.
quite many. There are quite many
Okay.
because Nigeria has, like I said, Nigeria has the highest burden of sickle cell anemia, so we need to reduce this incident. So, there are a lot of AA in the system, so we need them. I mean, over 40%. So when they marry AA, I mean, it's also reduced incidence. Before you know, we just have straight, and subsequently we can, wipe out sickle cell anemia in Nigeria.
Okay. Now the half is almost over, but it's clear that SS is the worst. Can you talk about SC? Because for a long time, many labs could not pick up the C. You had to go to a very good lab to pick up the C. And some people used to think they were people with SC that or AC, and then they wouldn't know that they actually had sickle cell disease and wonder
So
why they
it is
were,
important.
and they were wondering why they had symptoms. But now it is so important, I think, to go to a good lab to make sure you get the diagnosis right and you don't get the diagnosis missed.
So it is important to go to good labs because these hemoglobin, the way the tests are run, they overlap. So you need a good lab to be able to, make a proper diagnosis. So you have patients that have hemoglobin S and C, they might be on the same band. So it is important to get to a good lab to make these diagnoses. And then that's why you find that some people, they will tell you that, oh, when they were about to get married, they didn't tell them that they have, these traits, and now they have a child that has sickle cell anemia, or they have hemoglobin C. So it is important that a good lab would be able to separate these hemoglobin properly and be able to make adequate diagnosis for an individual.
Thank you, Bukola, for coming on the program. You are from the Sickle Cell Aid Foundation. Can you tell us about the Sickle Cell Aid Foundation and what makes it different from the Sickle Cell Foundation?
Yeah, so thank you for having me. The Sickle Cell Aid Foundation was formed in 2010, and we started just seeking to support people living with sickle cell, especially those that are indigent, around Abuja. So we started in Abuja with a couple of friends of us in law school, and then we've kind of taken it from there. We continue to support people living with sickle cell around the country. It's usually socioeconomic support, so things like paying for hospital bills, paying for medication, sometimes supporting them with education and things like that. We also do a lot of advocacy, so teaching people with sickle cell how to advocate for themselves, how to know what's best for them. Things like nutrition as well have become very important to us. So teaching people living with sickle cell the best foods to eat to kind of enhance recovery or prevent crisis. And then we do a lot of education generally on genotype, similar to what Dr. Davies has been talking about on prevention of sickle cell.
Okay, so
you asked for the difference. Sorry, you asked for the difference with the Sickle Cell Foundation. So the Sickle Cell Foundation was set up through the government institution. They do a lot of stuff and we pretty closely with them, and we have a good working relationship.
Okay, that's great. So can you tell us a bit about the food that people are listening, and anyone who hears about food and nutrition to do with something. You know, as they said, let food be thy medicine. It's the best thing. So can you share with us the kind of food that the sicklers and people with sickle cell trait and sickle cell disease should be eating?
Yeah, absolutely. So this kind of started about 5, 6 years ago. When we realized that a lot of people that we support living with sickle cell, especially for children, are malnourished. And that's just usually because they have frequent crises. When you have crisis, you usually don't have an appetite. And if you're having frequent crisis, you're having issues with your stomach, they kind of develop challenging relationship with food. And then also generally for people living in big cities, there's kind of movement away from preparing fresh food and eating a lot of fast food, a lot of instant noodles, things that are very quick. But a lot of those things have really high salt and are probably not the best for you if you're kind of going through hemolysis and having constant crisis. So I wrote a cookbook, and we've used that as a way to teach people living with sickle cell on foods, best thing to eat. In terms of foods, the first thing is really hydration. A lot of times people with sickle cell have to drink a lot more water than like, no one say a regular person, but someone that doesn't have sickle cell. And oftentimes there's kind of like a tiredness of drinking water, but really there's no replacement for water. You can't substitute water with a fizzy drink or with a smoothie or anything. You really just have to drink the water. And then if you want to, kind of mix it up and have other things like smoothies, we encourage, you to try and make it fresh at home if possible, so that you kind of know what's going into it, that there's not too much added sugar and preservatives and things like that. So smoothies are always a good way as well to get hydration. We always advocate for soups as well, especially for people who are just coming out of crisis, who maybe your appetite is a little down or you're in hospital yourself. Different types of soups, fish, beef, all those things, because it's giving you the hydration you need and a little bit of nutrients and protein. So protein, as you know, is the building block of the human body. And so we advocate for like high protein diet. Again, there's kind of this association with eating well and money. So it's like, oh, I don't have money to eat like super expensive things. But regular fish in the market doesn't have to be expensive. You can buy, fresh fish, smoked fish. Those are very good quality protein that people can incorporate into their diet.
So a lot of it, the mainstay water, drink a lot of water, keep hydrated, and try and eat high protein and vegetables. Excellent.
Yes.
Now, can you let us know a bit about, because there's not much time left, what you do in terms of preventing sickle cell disease? How do you, deal with that in your foundation? Do you go to schools? What way do you do it?
Yeah, so we do free genotype tests. We usually do that on campuses in particular. So we've worked with University of Lagos, Yaba Tech, University of Abuja, and we carry out free genotype tests and education for people, because we think that population is still at that crux where they haven't oftentimes made a decision or they haven't had children yet. And most of the time people don't know what their genotype is. And so we do this free genotype test as a way to open up the conversations for people to kind of know that, okay, if you carry the traits exactly as Dr. Davies has explained, these are the precautions you need to take when you are seeking to have children. If you do decide to go ahead with someone who still has the traits as well, there are preventative things that you can do, but just make sure that you're aware of whatever it is that you're going into.
That's fantastic. Thank you. Do you have a number? So just in case there are people out there who are listening who want to support you, is there a number they can reach you on?
The best way to reach us is either through our website, which is scaf.org.ng, or our social media, which is SCAF or Sickle Cell Aid Foundation on all social media platforms. We respond a lot quicker that way.
That's
SCAF.org.ng, yes, and
Perfect.
through our social media as well.
Thank you. Dr. Davies, coming back to you. Now, we've talked about prevention by not getting married. What about prevention from other means? Is there a way that people can prevent themselves if they've gotten into I don't want to call it an unfortunate position, but they happen to have fallen in love, they happen to have gotten married, the two ASs, and usually what happens is the way they find out is they actually have a first sickle cell child. So they want to prevent themselves from having a second one. What can they do?
Yeah, thank you. When they get married, it's a game of chance, because the probability of having an SS child in a single pregnancy is about 50%. So it is important that they could do IVF, which is now the commonest ways of preventing having children with sickle cell. And then they will have to do not just IVF with pre-genetic testing. They must be able to get the genetics of that embryo before they transfer into it. It used to be amniocentesis when they are 13 weeks pregnant, they check and then find out if the child has a genotype SS determinate, but it's no longer viable. So I would say they will just wait and pray if they can't afford IVF with pre-genetic testing. It is still not advisable that they get married because they could have children all 4 SS. If they are lucky, they could have all AA. If they are lucky, they could have all AS. If they are lucky, they could have just 1 AA and 3 AS. So it's a game of probability for each pregnancy. So it is still not advisable that they get married.
Wow, that's tough. Now, what about treatments? Now that people starting to do revolutionary things. The other day we had Dr. Kazim on the program talking about stem cell, transplants for sickle cell disease. But that was some time ago. Is that becoming more common? And we've also had one of our doctors from Benin, who has also started a program. Has it taken off? How much are those kinds of processes being done here in Nigeria? Where people go abroad, for example, India, South Africa, US for these processes. Yes, but how about here?
The definitive treatment for patients that have already, been diagnosed of sickle cell anemia without complications is to do a stem cell transplant. Dr. Bazaye was the pioneer of sickle cell transplant in Nigeria. Is based in Benin, a professor, and then he's doing a stem cell transplant for a patient with sickle cell anemia. But it requires a lot of fund. I mean, a lot of fund, minimum like 5 to 10 million for you to be able to, do a bone marrow transplant in Nigeria. So you need the government interventions. I'm aware that Lagos University Teaching Hospital is also coming up with a stem cell transplantation. The Sickle Cell Foundation too is really working on, be able to, do stem cell transplant in Nigeria. So there is a lot of money being pumped in by governments into research where we can conveniently do this transplant in Nigeria. But presently, Professor Bazaye is, doing a lot of bone marrow transplants. Luth is also, very soon will start. But for now, a lot of people are going outside the country, Italy, India, South Africa, US for bone marrow transplants. But it's the definitive diagnosis, treatment for now for patients that already have a sickle cell anemia that require to live a near normal life.
Yeah, I think, these things can be so traumatic. I actually didn't get a chance to talk to Bukola about it, but she's gone through it herself. But I know that sickle cell disease is such a painful condition. I had one of my roommates had sickle cell, and often they die young, and can be so traumatic. So if there's anything or any way that people can support the foundation for people who have who are living with sickle cell disease, it would be wonderful. And also for those who are looking at setting up those transplant programs here in Nigeria, we want to encourage them to do the same. Do you have any last words for our listeners?
My last word is to get tested and know your genotype.
Thank you very much.
Thank you for watching. Please like, share, and subscribe for new video updates.